I'd like to welcome everyone to our area-wide council meeting. It's not January though, it's April. We were just testing. The spring meeting is always really a fun one for advocacy updates. And so I want to again welcome our guest speakers that are here. And also Commissioner Smale, I saw you joined. Hi, nice to see you. Thank you for joining us from Wayne County. That's always nice to see our elected officials popping in on our area-wide advocacy council. Like I said a few minutes ago, our chair is not here and we don't have any official business except to approve the minutes. And so we'll skip over that and approve the minutes next month or next meeting in July, where we hope to meet in person. So more to come on that in the coming weeks. But I am, for those of you who are new, I am Matt Reed. I'm the Senior Vice President of Community Engagement and your MC this afternoon. I can say afternoon now. Thank you for joining us. And I think if it's okay with everyone, I see some nodding. We'll go ahead and get started. So if I could have the next slide, please. And we can skip to the next one. And I will tell you all about my adventure in Washington, D.C. this week. So advocacy wise, we'll talk about what's going on at the federal level and the state level today. It's got some cool new momentum to talk about. And then I will turn it over to Courtney, who will introduce our panel and get us rolling on that. First up is our U.S. Aging Conference, which you may know this, previously known as the National Association of Area Agencies on Aging. That is our national trade association, rebranded last year into U.S. Aging, which I just love that name. They have a policy summit and get all of the advocates from across the nation together to talk about aging policy and impact. We heard a lot about current efforts in the House and Senate to address things like the budget is kind of going through the process. We heard from a lot of different experts that said, do not look for a passed budget to be in effect October 1st, which is what's supposed to happen. Because those of you who watch the news and the political side of things know that there is some disagreement, I think you could say, on how to move forward. That's probably no surprise to anyone on the call. Right now, folks are battling back and forth between debt ceiling discussions. That's kind of the big thing on the Hill when we were there this week. But what we were there to talk about was the U.S. Aging Policy Priorities for 2023, which was released in a document. And Courtney, I can get you that PDF and we can get it out to everybody so you can have a full copy of the document that you see here on your screen. But I just wanted to highlight the four main priority asks for our federal advocacy. And those are, first up, Older Americans Act. As you've heard me say in the past, the Older Americans Act is the federal legislation that brought area agencies on aging into existence. It also provides funding that we get to help allocate as part of our oversight as the advisory council for the board. The Older Americans Act is set for additional allocations, appropriations this year. This all depends on what happens in Congress. The president's proposed budget had great increases for Older Americans Act, which is really helpful considering we have had COVID support monies for the past years to help prop up older adults in the community. Those funds are sunsetting and we still have many, many older adults in need out there that will soon lose access to things like meals. And so in order to address that, they've started to increase the Older Americans Act support, which had really remained stagnant or actually had been cut in previous years. So it's good to see that that increase is kind of ramping up. Our official ask is to double the allocation to Older Americans Act spending. And that may sound a bit much, but when you start to look at all of the demand and the need out there, boy, it would really help us if we could get that additional allocation and appropriation to that act. So the Older Americans Act covers a lot of different things, including personal care, transportation, legal aid, meals, and the wellness training activities that our agency is able to do with partners on the screen for falls prevention and other evidence-based wellness trainings. One of the programs near and dear to my heart in the Older Americans Act is caregiver support, which is the second ask in the policy priorities for 2023. We heard that informal caregivers, which just by a show of hands, either on your screen or virtually, I'm curious to see how many people here have taken care of an older adult loved one in some way, shape, or form. That includes driving to the doctor's office, helping to pay bills, grocery shopping, transportation. It's a lot of people. Yes, see, we've got hands popping up all over the place. Brandy Krzyzanowski is here. She's our Vice President of Planning, Quality Improvement, and all things provider relations, and she can attest to the fact that we heard from several caregiving advocates in DC, and I believe the number that I heard was $60 billion a year. That's billion with a B of free care is given to older adults in our nation every year by us, by informal caregivers that are family members and friends and loved ones that don't get paid to do this sort of work, but do it because it's the right thing to do. It's what we want to do. Keeping our parents at home, keeping our spouses at home, keeping our loved ones at home, keeping them happy and healthy and safe. But it comes at a cost. And, no one teaches you how to be a caregiver when you go through high school. It's one of those classes we miss alongside of paying taxes and how to do these other things in life. We don't get taught this. And so the National Family Caregiver Support Program was brought into existence to be able to provide support for those of us who are caring for older adult loved ones. We do that through a range of supportive services, including one-on-one consultations, training and education, respite services so caregivers can get a break, support groups, and then also supplemental services, so like kind of one-time supports that we can offer. It really needs to be a focus, and it really needs to be something that we can continue to talk about, because if we don't support these caregivers, that $60 billion in care is going to reduce, which means that the system that we have will become more taxed than it currently is. And as you have heard me say in the past few years, it's already a taxed system. So we can't afford to have any more stress put on this. We need to figure out how to relieve that and start serving folks better. So caregiver support is a way that we can do that, and that's one of our priorities. The third point is medical and community-based intervention integration. And that sounds like mumble, words, but yes, 60 billion, billion with a B. Because the most recent number I had seen was 1 out of every 4 people will be a caregiver sometime in their life. But you saw the hands go up like I did. I really do think that it's more than that. And so you've got all these people out there caring for loved ones that if you were to put a price tag on that, it adds up quickly. I was taking my mom to several doctor's visits when she fractured her hip, helping to kind of navigate that process, and it adds up in time and cost. So back to the medical and community-based intervention integration. What that means is you've heard us talk about the social determinants of health before. Those are the non-medical things that can impact a person's health in the community. Things like food and food insecurity, transportation, like we're going to hear about in a little bit, housing needs, access to social supports and education, access to the medical community. All of those things can impact people's health. And so in order for us to really improve that, we need to concentrate just as much on that as we do the doctor's office visits and things like that. So what we're saying here is that area agencies on aging across the nation have become an expert in this space, in the community based intervention space, where by our designation as an aging and disability resource center, we are put in the great position to be able to navigate all of the different options out there in the community. We are always looking for the resources that are available, the programs that have funding, the ways that we can allocate, the ways that we can direct people to those services. What we need to do is work better with bringing the medical field alongside the area agencies and other community-based organizations, like several of you are representing on the call today, to make sure that we are at the table and that we have a system that links everyone together, so that when my loved one falls and breaks a hip, she doesn't just worry about going to the doctor, but also can worry about, how am I going to get in a house that had 3 steps and now I can't do steps? How do I go home? And, how do I do all these other things that may or may not be navigated by a discharge planner or a social worker? And those of you who have been discharged from a hospital recently probably can attest to the fact that you don't get a sheet with directions, you get a folder full of directions that are about this thick. And so navigating all of that is tricky. All of that to say, we believe that area agencies on aging are a valuable resource across the nation that the medical community can interact with to better support their patients, and then we can better support the people that we are driven to help by our mission. And then finally, and this will not be any surprise to you, we definitely need to keep talking about the direct care workforce and the fact that the reimbursements are too low, the workers are not there, and people are going without services right now that they're eligible for these services. There is funding to provide these services. There are no aids to provide the services that we can give to folks because of issues out there. So we need to keep talking about that. We need to address that, and that is our 4th policy priority at the federal level. Now, you might be asking yourself, Matt, what were you doing in Washington, D.C.? And I will just take I'll take 2 minutes and tell you about this crazy trip I had. I've been doing this. This was, I think, my 15th year of going to the Hill and visiting with the elected official aides and staffers to talk about these policy priorities, try to explain why it's so important, make it real to them. And this year was different. And so our new congresswoman, my personal, where I live, my new congresswoman is Amelia Strong Sykes. I got to meet her. And this is the first time I've ever met with the actual elected official when I go to the Hill in 15 years. And so I was really excited about that. But here's what happened. And there's Brandy on the far right, and I'm on the left. Amelia's there in the middle with our COO, Abby Morgan. We were in the waiting room waiting for our meeting. We weren't sure if we were going to be able to meet with the congresswoman or not. They were voting on the debt ceiling at the time. And so one of her staffers, her legislative lead staffer, came in and said, are you up for a walk? And I was thinking, when people have said that to me in the past, we walk down to their cafeteria area where we can talk because the meeting rooms are full. He said, okay, great, you're up for a walk. We're going to go to the floor. And Brandy and I looked at each other and we were like, what floor? And he meant the Congress floor. And so we got to go underneath the tunnels, through the secret passages, up into the Capitol building. And the picture that you see before you is 2 doors down from the floor where they were voting on the debt ceiling. And I completely geeked out. So all the cynicism that I usually have with advocacy fell away, and I believe in the process again. So it was a monumental experience, and I was very happy to do that. And if you think I'm talking quickly now, you should have been in that room, because I went through all 4 of those priorities in, I think, 2.5 minutes. All that to say, the Congresswoman was just lovely to speak with. She listened. She understands these issues. She's been a great supporter of area agencies on aging when she was here at the state level. And I feel like we have a great advocate at the federal level as well now. We left our materials with her, and we'll be following up with her staff early next week on next steps and how we can start to bring this into her district here back home. So other AAAs were doing the same thing. Several of our members of Congress have overlap, and so other area agencies were meeting with some of the representatives in our area. It was a great visit. It was a great time, and I am so happy that I got to go and represent all of you and all the older adults in our area in our nation's capital this week. So I will pause here for just a second and see if there are any questions on the federal advocacy or anything I've talked about so far. I'm going through the chat to make sure. Doesn't look so. All right, so I will keep going, like I said, so I can give our guest time to speak. So update here in Ohio. When I left last week, the first box in this graphic was ticked off. And so the biennium budget for Ohio that starts in July and runs 2 years was introduced in the House, and it was in committee. When I got back and pulled this slide up for this morning, we had gone all the way through the House and they're now in the Senate. So that's how quickly these things move. It's kind of wait, go. And so right now we're in the go phase. And so it's the biennium budget has moved from the House Bill 33 over to the Senate side. The Senate does a review, puts out their version, and then it goes to a joint committee where those two arrows come together to hash out what the final budget looks like. And then it's sent to the governor for approval, where he can approve it. And he also has a line item veto ability there in the budget. So you might be asking, well, where do we stand right now? And we've got some really good news to share. In the governor's budget, we had an increase in direct care workforce proposals for up to $17. We're up to $18 now in the House bill. We're hoping to get that to $20 an hour. We feel like that would be able to help us add, attract and retain talent to the workforce to be able to help the people in their homes that need it. So we're excited about that. The second point is creating an exception for the home care licensure to help get more aides into the process and reduce some of the challenges around training. There's also a healthy aging grant line item this year that we're really excited about. This would bring several $1 million into our area that's going to be directed by the county commissioners and the county executive in Summit County to have access to these funds to help people who are not eligible for Medicaid but can't afford to pay out of pocket for services that they need. So that those folks that we really continue to try to help with limited funds, those grants will help to prop up some programs for them as well. And then finally, a little bit of bad news, but not a huge, is there was a small reduction in the senior community services appropriation from around $12.8 million down to $11 million in the House bill. And then just some other updates in long-term care systems. The assisted living waiver retained at 48% increase, and the removal of tiers with memory care add-on in their rates for Medicaid assisted living. And there were a lot of increases in nursing homes. There was additions to their Bill of Rights, increase in rate rebasing, which means, whenever they look at how much they make from 5 years to 2 years, and general rate increases in different areas. Direction Home has access to we saw an article in the cleveland.com that put out there to talk more about this, and we'll be sharing that on our social channels next week. So keep an eye out for, make sure you follow us on Facebook, on Twitter, or on LinkedIn to be able to link up with that news there for more information on the Ohio biennium budget. So I know I talked really fast. Like I said, I wanted to cover a lot of stuff. So if we could just pause here for 1 minute before I turn it over to Courtney. I saw a couple different questions come in. Melissa asks, how was that rate determined? The $17 to $20 rate. It's not clear what the reimbursement rate would be for providers. So that's a good question. I don't know how they came to that rate. I know that we as a network of area agencies got together to say, well, where are we now, and what are like jobs making, and what does the rate look like, and what do we think we can ask for that would be reasonable, and that's kind of what our lobbyist and others came up with. And yes, I don't know what the reimbursement rate would be for providers, because the legislation really was trying to figure out how to target the take-home pay rate for the aides to go up, and not the flat provider rate increase. So more to come on that when we know more about how that comes about. Sometimes that will be even after the budget, where then once the budget is passed, then the governor's administration figures out how to make all these things live if it's not specifically written out in the budget language and legislation, is my understanding. So Crystal says, is that healthy aging grant only for Summit County or for all counties in our area? I do believe it's for all counties in our area, Crystal, and we should be getting more information on that as the budget moves forward. But right now we are, I believe we are looking at grants to the counties based on population. So that will be why the numbers look different, and that Summit County will get more than Stark County, will get more than Portage, will get more than Wayne, because that's how our population breaks out in those counties. My pleasure. Any other questions? Or Brandy, anything I missed from our travels to DC that we should bring up? All right, great. Well, then I will put myself on mute and turn the program over to the main topic of the day, which is transportation panels, challenges, barriers, opportunities, and the advocacy work that we can do. Courtney, take it away.
Thanks, Matt. Good afternoon, everyone. Thanks for jumping on today. And thank you to our panelists for generously lending us their time and expertise to talk a little bit about transportation. We are very fortunate to have representation of all 4 counties, Portage, Stark, Summit, and Wayne today. So we ask them to just speak for about 5 minutes about the challenges and barriers, opportunities, and potential advocacy work that you all could help with in each of those counties. And then we'll open it up for some Q&A after. So please feel free to drop questions in the chat as they move forward. I'll keep track of them. Or if you want to wait until the Q&A formally starts, you can do that as well. And of course, we always welcome turn your cameras on, unmute, pitch in however you'd like. But with that being said, we're happy to welcome Bambi Miller, Metro RTA Director, Customer Impact and Responsibility, Jan Conrad, Community Action Wayne Medina Mobility Manager, Denise Baba, Pardo Communications and Public Advocacy Advisor, and Clayton Popick, SARTA Director of Development and Special Projects. So we'll start off with Bambi, and then when you're done, we'll pass it off to Jan.
Thank you, Matt. Thank you, Courtney. So we've been very busy at Metro RTA in Summit County. We're working with a Reimagine Metro plan that we have been working with for over 2 years. During COVID, through COVID, after COVID, the major points about Reimagine Metro, we are increasing frequency of service. That's what our passengers have asked us for years. That's what they asked us through this entire process. So we are on the line service side, the fixed route side, the Metro, everyone have to look, the Metro Direct side. Yeah, Metro Direct, the big bus side. We are changing 6 routes to 15-minute routes where, and one's being eliminated, where the 2 routes of those were 16 to 29 minutes. That's great for passengers. Think about people standing out in the rain, in their mobility devices under a shelter or not a shelter in the rain or the snow. We now will have 9 routes in the 30-minute service range. We will have 7 routes in the 60-minute service range. And then we have 1 route, the X61, which is our commuter route to Cleveland, that is just rush hour service. The challenges to growth, I'm sure that we will all parrot the same thing. Internal workforce challenges have been huge, continue to be huge. We are constantly in a hiring mode, so we're constantly in a training mode as well. In order to provide this frequent service, we need more people behind the wheel of a bus. And that's been challenging. You know, the pandemic and our aging workforce that we've been talking about for a while here at Metro, and people have just retired early and decided, okay, the world has changed, I'm moving on. With Reimagine Metro, we have looked at the big bus side in a more linear fashion. So if you can imagine, Summit County, it looks like a bowling alley. We have most of our routes are centered within Akron. There are some that extend up into the north. We're eliminating some routes that weren't heavily used. So Green, for instance, in the south will not have service. We're changing a route going up north, which will affect workforce development, and Bathurst Ridgefield will no longer have service in order for us to provide the 15-minute service for the routes that people really do ride. So those have been our biggest challenges: internal candidates to hire, internal training, just finding people that want to make being a bus operator as their career. Opportunities that we want to pursue. So we're trying to get into workforce development largely because it's out there and it's a hot button for everyone. The service that is going around in the transportation business, the sexy term of first mile, last mile, that's pretty much something that we've been doing. I think everyone knows that we've had a SCAT service in place in Summit County long before the ADA service. Alan Smith was a forward-thinking visionary who took this over from the city. So we had a wonderful program in place that is near and dear to all of our hearts. And we think of it as the fabric of Summit County. That will remain. And I think Nakia is on the call, and she is in charge of working with eligibility for ADA. So she has been extremely busy as we encourage more and more people to sign up for ADA. It's not that we haven't been encouraging people for years, but it would now, we need to explain to everyone that you'll have more service if you have ADA rather than just having a SCAT service. SCAT has a lot of restrictions to it, though. Again, it's a wonderful service. It's one trip per day. And ADA, as long as you qualify as a person and you're qualified where you live within that 3/4 mile that is mandated by the feds, then you're good to go as long as there's a bus going where you're coming from and where you're going to. All great. You can ride throughout the day as many times as you want. So we're encouraging people to not take advantage, but sign up for a program that they deserve to have. We're pursuing the workforce development at another angle. We tried a pilot program started right before COVID hit, called Flex Ride, and that was for employers trying to get employees to work. And that was a unique pilot program that we went to the person's house, kind of similar to SCAT, and took people to work. Thank you, Nikki. I appreciate that. Nikki has just put information in the chat and beat me to it about Reimagine Metro. If you also go to our website, yourmetrobus.org, you can get to the information on Reimagine Metro, which has some great interactive sites that you can see what you ride now and what you will be riding in the future. But on the workforce development side, we now have employers that we no longer reach by their door. And perhaps that line service that is closest to them is not close enough for an employee to safely walk or roll to work. So we're trying to put into place different demand response options that will take someone from a line service bus directly to their employer. So that's a top priority for us, as well as continuing the SCAT service that we provide in Summit County. Policies being debated. We have a call a bus service in the north and in the South County. The South is not being used. As a matter of fact, the mayor of Green didn't even know about the service. So I think we need to do a better job marketing things through the municipalities that we're in. But we also want to look at call a bus throughout the county. So if you can imagine Summit County is that bowling alley. Well, if we have two down south, you can't see my map, we encompass Medina and Stark. We can, venture into Portage. We do venture into Cuyahoga County. We can venture into Medina. If we help people on the fringes, because in RTAs, we know where the lines are for the county, but as people, do we really know where the lines are as a county? I mean, we still cross that line to go to the grocery store, cross that line to go see mom, cross the line to go to work, and we don't see a line. We don't care about a line. So why shouldn't RTAs feel the same way? So we're working on that. We're working on the Metro work side, and then again, encouraging people to sign up for the ADA service, which has made Nakia very, very, very busy. But I think one of the most important things that I want to share with everyone, we all need to remember to be people-centric. I think it's easy to lose sight of that in different industries that are on the periphery of taking care of seniors and persons with disabilities. But it's really the person that comes first. The challenges that we have in our different organizations are challenges that we need to understand and fix. But we need to remember that people walk, people roll, people use services differently, but are entitled to those services. So whether you live in a city limits or like us, you have the broader county limits, it doesn't matter. People still need to get to where they need to go. And accessing services should be available to all. What we have done, what we'll be doing more of once we get through Reimagine Metro, which begins June 4th. We have done more outreach since I've been here nearly 16 years, and I can honestly say this round of public outreach has been like no other. We have gone to over 60 meetings. We've had all the information out there we can think of. We've gone to other people's websites. We put it on our website. We put information out there. But no matter what, and no matter what the industry is or the situation or the time, even if you think you've done enough outreach, you never have. There's always someone who's not going to know, someone who wasn't paying attention, or the digital divide, someone who didn't see it on the website or didn't see it somewhere. So there are still going to be surprises for people. The days leading up to Reimagine Metro, it's all hands on deck. We'll be at the transit center talking to people. We'll be, the bus stops do have signs on them for the ones that are being eliminated. So that's out there now. Customer service is, gearing up to be answering phone calls throughout the day. Our biggest fear is that someone is waiting at a bus stop and the bus will never come. So no matter what we do, we always have to do more outreach. We put focus groups in place. I think focus groups are a great thing. I think in every business that deals with seniors, persons with disabilities, or anyone else really, any customers, focus group should be an ongoing thing and not something you do every once in a while. And I think you need to change up the people that are in those focus groups. But we have amazing agencies in Summit County, and I'm going to brag on Summit County. It's an amazing place to be. We're very collaborative. We look in the gray areas. We don't stay within the black and white because we know that safety nets need to be put in on the periphery of every program that we have. So I'm very blessed to be in Summit County, to be a part of that system. And know your agencies, know the people on the agencies. They're great people. I've made a lot of long enduring friendships, and we help each other out. Sometimes I don't have something to do with something, but I'll get a phone call from the mayor's office and they'll just need something only because they have my name. I'll call Matt because I don't know who I need to talk to at Direction Home, but I know Matt will help me. We all need to have those contacts in every agency. So if that's the only thing that comes out of my entire talk, please reach out to your agencies, make a friend there. They'll help you every step of the way. It does take a village. So, and we need a bigger village. So I tried to capsulize as much as I could, but I could ramble on forever and ever. So I'll be quiet now. Thank you very much for listening.
Thanks, Bambi. You have backup to address the questions in the chat, so that's really convenient. So Jeannie asked about service to green being terminate or eliminated, and then thanks, Nakia, for putting that answer in the chat. If you have more questions for Bambi, feel free to pop them in there. But in the meantime, we'll turn it over to Jan.
Thank you, Nakia.
Well, thank you, Courtney. So I'm Jan Conrad. This is my first meeting at the with the Area Agency on Aging Direction Home, so I'm really happy to be here. I've been with the Community Action Transportation Program since December of 2021, and I believe I'm the only county in this group today that's talking that really does not have public transit per se. I'm a mobility manager, and our charge is to work specifically with individuals who have barriers to transportation and as you all know, there are plenty of those people out there. There's never a lack of someone that has a barrier to transportation. But I just want to give a little overview background of like where we came from this last year. So we have a couple of things that are exciting. We have a partnership with the Stark Area Regional Transit Authority for Wayne County Transit, which is our pretty much our workforce transportation, our rural transportation, and that's been something that was developed before I arrived, but in 2022, we really increased ridership. I think that it was 175% at one point. We were up over the year before, which was mostly because it was started during COVID, and that was not a great time to start a public transit program with all that was happening, as you all know. So that's a great partnership that we have, and we are excited to be working with them on that. That's really our, we have a cobbled together system. And that's one of the biggest challenges that I've realized since being there, is just being able to articulate to our population what particular piece of transportation do they belong on. And we're working always to try to market that, but you know, contrary to public transits, we have actually 2 people in our transportation department. So we don't have the depth of staff that I would love to have, but we do what we can with what we have. And I think we're doing a lot of exciting things. The city of Worcester is one of the providers in Wayne County. They've been funding transportation out of their general fund for about 12 years or 10 years or so. And it really is amazing. Last year, inside the city of Worcester, working with private providers who are contracted with Community Action, and we actually manage that grant for the city of Worcester, those grant funds. We were able to provide 68,000 rides just within the city of Worcester. And those rides all went to people who qualified as low income, elderly and disabled, veterans. So it is amazing how utilized that service is. We do have a loop service inside the city as well, that those who are a part of the program, who are part of the low income elderly group that we service, they're able to ride that loop service for free if they just have their ID with them. And so that's a great service. One challenge was that that provider that's been doing that for the last 6 years just provided their notice of suspension of service as of May 19th. And just before I hopped on this call, we were talking with the next provider that we'll be bringing in and trying to solidify some things. So we will be announcing who that is probably next week to the public. And it's exciting. It's a lot of work, but I think that good things can come out of this. Crossing county lines. It was interesting to hear my colleague talk about that. And, you know, I haven't been in transit all my life. I've been in startups within organizations, running entities where I never really had to think about the county line. And it is kind of amazing that we think service has to stop at the county lines, but I understand from a funding, you know, how it became that way. But as I know, Kurt Conrad has often talked about when those county lines were drawn, it was in the 1800s, and we're still operating out of that paradigm, which I think is exciting to hear that the RTAs are looking at ways to move past that, because that's one of the biggest challenges that I have in Wayne County. We have a lot of entities that are like the Cleveland Clinic, Akron Children's Hospital, that have a presence in Wayne County. But when it comes to procedures, they all have to go to those locations. They don't do those things locally. And getting them across that county line is very, very challenging. Part of it is capacity. Our private providers have had the same issues that public transit has, and that is keeping drivers. The COVID really just changed so many things, and workforce has really been impacted, as everyone knows. And so we have private providers, but when their employees don't show up, that becomes our problem. And that's part of the reason we're working with all kinds of ideas for how we can address having the volume and the capacity to serve the people that we need to serve. We also have a service in Wayne County that our county commissioners provide for that same population that is in the city of Worcester, that is low income, elderly, disabled, and veterans. And I will tell you, there's never enough money to serve everyone. You know, we are always looking at how we can leverage the funding that we have and how can we partner to better, to provide better pathways to more volume for being able to get out into the entire county. We are considered rural. We have 116,000 people in Wayne County. And we have a lot of rural Wayne County that still does not really even know that we have this Wayne County Transit partnership with SARTA, and that they could actually ride for $2.50 a ride. They are starting to learn, and we process all those applications. And my goal has been this year to get out into all of the villages of Wayne County to make those communities aware of what we have. And I did not get to all of them in 2022, but 2023 needs to be the year that we host meetings in every one of those villages. One thing that I really appreciate about Wayne County is that we are very collaborative, and we have a housing coalition that meets monthly, and we all share ideas and thoughts, challenges, and are able to find out what each other are doing. And then we have a transportation coalition that is a part of that organization that is really helpful in looking at what do social services really need that we're not able to help them with. And how can we better communicate? How can we work together to make those that fall through the cracks, many of whom they serve, that are not eligible for one reason or another, whether it's they don't have proper paperwork, or they're just at that bubble where, and this is anybody. I mean, I have citizens all the time that, you know, call, and they are at a place where they're just over that amount of money, but their car breaks down. And so we try to serve those people the best we can. And I think we do as good of a job as we can. We have an action fund that sometimes we can tap into to serve people who just don't qualify for any of our programs. So those are the challenges that we deal with every day. And the one thing I just totally agree with you on, Bambi, is that this is customer-centered service. Each one of our rides are based on what that individual qualifies for. And so, you know, our community doesn't really even have they don't have public transportation, but it isn't really something that a lot of people even know a lot about, because we're rural and it just hasn't been something that's ever been there. The important piece, I believe, is helping people understand that if they have needs, we will make a way somehow to serve them, even though we don't have public transportation. And as far as advocacy, I'll just say this: I've been involved with the mobility managers all across Ohio. There's 44 of us. We together advocate at the State House. We belong to the Ohio Public Transit Association, OPTA, and participate in Legislative Day, and are doing really what we can with our local officials. And I've found our county commissioners to be very supportive. We're having a lot of conversations of where we go from here. And I'm really excited about what's happening in transportation in Wayne County. Thank you.
Great, thanks, Jan. I don't see any questions in the chat, but again, feel free to pop those in if you come up with them as we go through the presentations. Jan and I met actually a couple weeks ago, and I introduced her to Direction Home, and now she's sucked into our clutches. So thanks for jumping on, Jan, and we can turn it over to Denise.
Hey, good morning, everyone. My name is Denise Baba, and I'm the Communications and Public Advocacy advisor here at PARTA, the Portage Area Regional Transportation Authority. While Jan was talking, I put a link to a PDF in the chat, which will take you to a summary of some of the things I'm going to be talking about this afternoon. So last fall, PARTA made a major software procurement, which is going to affect every aspect of our service here, our operations, I should say. And I would describe it, and it was a challenge because one of the things we had been using some software that that we had for about 20 years. And I describe it, my non-technical, I'm not on the operations side, is kind of like a Frankenstein monster. Over 20 years, as we needed something else, we would add it. So the software worked together, but it didn't work as well or as efficiently as it could have. So we went out for the software procurement to get software that was really meant to work together to make us more efficient and serve our riders better. And if it affects both our demand response side as well as our fixed route side. So one of the things that's different about PARTA is that we do fixed route. So we're classified as urban, but much of Portage County is rural. So a lot of our door-to-door services out in kind of like the hinterlands of Portage County, in Atwater, and maybe out in High Rome or Wyndham. So we're like a combination of an urban and a rural transit provider. So one of the things that our software would do, and so a lot of folks, maybe our aging population, uses that door-to-door service to get to medical appointments, dialysis, do grocery shopping. Before, when you were called into PARTA to schedule one of those rides, we did those on a first come, first served basis. And then we asked people to schedule up to 3 days in advance. And the night before, you would get a call to confirm your ride. And then the day of your ride, you would get a call to say the bus is on the way. So now what our software does, in an effort to provide as many rides as possible, you're not actually scheduling a ride, you're more requesting a ride. And the night before, all those rides that have been requested, the software looks to see how we can provide service to as many people as possible. So before, say, if you requested your ride and you were way over here, we would come pick you up because you had scheduled your ride, and then we go way over here to pick up this person. Now the software is looking to see what's the greatest number of people that we can deliver service to based on all the rides that have been requested for that day. So we're actually delivering more rides, but some people are experiencing right now some trip denials because maybe for this particular day, the majority of rides are over here, but you're way over here. So you might get a trip denial. But the early results are showing that we are providing more service to people on that door-to-door service. Also, that software allows us to you can request a text message when your bus is on the way. And as part of that text message, there's a link which you can click on and you can actually see your bus on the road. This is for door to door as it's coming to pick you up, so you can track it and you don't have to call and wonder, well, where is the bus and how soon is it going to be here? Because we still have a half an hour window for when that bus could show up. You can actually watch your bus in transit on its way to come pick you up. Later this year, or maybe next year, our door-to-door riders will have the ability to schedule or request their own rides online through a portal, rather than having to call. People can still call. Our scheduling department will still be here to answer the phones, but it provides the flexibility for people to call and schedule their own rides. So that's on the door-to-door side. On our fixed route side, so several years ago, we introduced digital ticketing with Easy Fare. It's an app that you can put on your phone. And instead of actually purchasing a physical ticket, you can buy a digital ticket online through the app. Now, later this summer, we're going to be introducing account-based ticketing. So what's the difference? With a digital ticket, you're still buying a trip. With account-based ticketing, it's kind of like a Starbucks card. You know, if you ever had one, you kind of load like maybe $25 or $30 on your Starbucks card, and every time you go, you swipe it, and it deducts the price of your cup of coffee, whatever that is, off of that account. So the money is coming off of the account. So that's similar to what we're doing. You can have an account with PARTA through the Easy Fare app, and you can put money on that account, say $15, $20, $25, whatever you want. And then instead of buying a ticket, every time you tap your phone, or we will be introducing new smart cards. You tap that smart card, it'll deduct the ride for that trip off of your account. So it's, if you're taking one trip, it's $1 here for PARTA. One of the things that allows us to do is do fare capping on our fixed route lines. Some people may not have the ability to pay for, say, a monthly pass up front, which is $45. Maybe they can only afford to put $5 or $10 on their account at a time, but over the course of the month, they would have ridden the bus enough that as they swipe their card or swipe their phone, they would have paid for a monthly pass. Well, now our software will recognize that, and when they hit the limit where they would have paid for a monthly pass, we will cap them and they will no longer pay fare for riding for the rest of that 30-day period. Same way, if you're buying a daily pass, maybe you get on the bus in the morning, you don't realize you need a daily pass, you take one ride, that's $1, you swipe your phone again, that's another $1. You would have paid for a day pass, and maybe you didn't want to buy one at the beginning of the day. If you ride the bus a third time that day, you won't be charged. So account-based ticketing allows us to introduce fare capping. And we're also going to be introducing a new bus tracking app. It's called Passio Go. It's going to replace our old bus tracking app. So that'll allow folks, again, for fixed route buses to see where their buses are in real time. So you don't have to go out in the rain and wait at your bus stop, or if you're in the middle of something, you can just track and see where your bus is at and get to the bus stop when you need to get there. So our challenges, I'm going to say, are similar to some of those that have already been mentioned. Drivers, we don't have enough drivers for fixed route or door to door. We can always use more drivers. Also, just as we introduce some of this new ticketing, it's, a challenge to get the message out and let people know what's happening. And I'd also say that, along with that, we realize there's not everybody is going to want to do digital ticketing. So on our fixed route side, we're going to be taking our old electronic fare boxes, which are at the end of their useful life, and rather than investing in new ones, because we're using this digital ticketing with validators, we're going to be replacing those fare boxes with kind of like the old style mechanical fare boxes where you just drop your dollar or drop your change in, and the bus driver sees what you've dropped in, and he hits a lever and it goes into a small vault. So at the one end, you've got digital ticketing with a validator on the bus, and the other end, we still are making provisions for people who maybe don't or can't, don't want to use or can't use, or for whatever reason don't want to do digital ticketing. They can still ride our fixed route buses using cash or change. So what are some of our barriers? I would say, I think it's just kind of general for the same as public transit anywhere. People who don't use public transit don't understand the value that it brings to their community. For folks in their community who either don't have a car for whatever reason, can't drive. And I'd also say one of the barriers just in general is the perception of public transit, that it's for those people, and that, a lot of our policies are around paving and building roads for cars as opposed to building for public transit, and developing for more developments that support public transit. But we see that I think that there are opportunities, particularly here in Portage County. I think the digital ticketing, once people get accustomed to it and used to it, will see the benefits of it. It allows them, so this digital ticketing, if you've never used it, like in the app on your phone, you can see when you've purchased tickets, when you've used tickets, how much you spent on riding on public transit. So it's an easier way to track your own mobility. Let's see, beyond that, I would say that in terms of advocacy, and I will give a shout out to Matt. So I made that same trip that you did back when Tim Ryan was our rep. I'm a former school board member, and you would go down every year to lobby on the Hill. And one year I was down there, and he said, yeah, let's do the walk. And he puts me in the elevator with all these people. It's a little tiny elevator, and they're all US representatives. And we went down a level, we get out, and I'm waiting for them. And they're all looking at me because I don't have the little pin that identifies me as a US rep. And he comes down, grabs me, and the person I was lobbying with, and I think it's the Rayburn room that you were in, and they took us to the Rayburn room. We sat there, and he would chat with us, and then he's like, "Oh, got to go take a vote." He'd go to the floor, take his vote, come back and chat. So that is a unique, great experience, and it does give you hope about the political process. But talking about that in the state level, if you were to say, what can you do? I would say talk to your state rep and senator about public transit and the impact that it has for you. Sometimes they don't understand, like I said, if particularly like in Wayne County, where you're in a rural county, let them know that, you may not specifically have a transit there, but you have public transportation there due to Metro. And our legislature at the state level has shifted, and in that conservative legislature that is kind of run by folks from rural counties, they need to know that there's public transportation in their counties. It may not look like public transportation in Cleveland or Dayton or Akron, but it's there. And so when they vote on that budget, they need to know that they are voting on something that impacts their constituents. Just because it doesn't look like a big bus that holds 40, or it's a 40-foot bus rolling down the street, they need to know that they have public transportation and it benefits their constituents. So that's like the hugest thing you can do, is just reminding them of that, and remind them when you're talking about the aging population in Ohio, remind them that aging population is using public transportation because maybe they can't drive anymore, or and not every aging person has somebody that can come pick them up and take them to the grocery store. So they are using public transportation. They may be using a door-to-door service, but that's like one of the hugest things you can do. And I'll just remind you, as you talk about the state budget, yes, the general revenue budget gets approved in June, at the end of June, but the transportation budget is always approved by the end of March. So our budget has been approved for this year, and we did okay. We were able to maintain the 70 million allocated for public transit in Ohio, and they added an additional 30 million for workforce development that is separate from those funds. But in 2 years, when we're talking, because transit is always like, we're never quite sure what's going to happen, and we'll take any kind of support that we can get. So that would be my recommendation. So that's all I have to say. Thank you. And again, that link is in the chat for anybody who wants to download those changes.
Thank you, Denise. I went to Kent, so I use the Part of Buses all the time. I know it's a great program, so thanks for all the work that you're doing out there. I know we're out of time, so if you do have to log off, feel free to, but if you can stay on, please do, because I want to make sure we get to Clayton. And Clayton, if you have to jump off a little early, please feel free to send us some information outside of the meeting, and I'll make sure to get that to everyone as well. And same with any questions you all have, feel free to drop those in the chat, and we'll address them. Clayton, I'll turn it over to you.
Okay. My name is Clayton Popick. I'm the Director of Development for SARTA, formerly from PARTA. So I worked with Denise for several years. So, I've been thinking a lot about these topics, and of course, listening to three people with great ideas go ahead of me. That's kind of hard to follow up on. And it also keeps my brain moving. So I've been scrolling ideas down, I think this whole time, there's a lot of great conversation going on here. I think some of the challenges here in Stark County with SARTA, we've been taking a good look, coming out of COVID, ridership dropped, obviously, workforce dropped, and trying to recover some of those numbers. I want to say, so one of our biggest challenges is getting drivers back behind the wheel, getting people back on the bus. But of course, the entire workforce model kind of changed. And I think we're going to, when people start working from home, Canton saw a handful of downtown businesses not bring their people back to the office. So a big challenge is that, kind of that perception. Now we have empty buses. Now we have, everybody throws everything our way. Delivery model is going to be, I think, the next step. We just finished up a big community and passenger survey trying to see what the county's needs are, and not just from the traditional rider perspective, but, like I said, community leaders. What do you see coming to Stark County? What do you see coming to Canton, Massillon, the major cities down here? And so I think you're going to start seeing SARTA doing a little bit more service updates, such as what Metro's doing. Part of reimagining their little the technology side of it. That's so how are they bringing the service to the passengers? Metro's redoing the service. So I think you're going to start seeing that type of thing coming out of SARTA here soon. Unfortunately, we're just not there yet. We're still kind of in our fact-finding stage. Some other things, though, that we do work to keep up on. Amazon just built out here. There's a lot of development. TSC, Shears, PepsiCo, they're all building out towards Massillon. How do we get our buses out there? One of the traditional challenges to transit is coverage versus frequency. So I can take 20 buses and send them across the county to service everywhere, but it's going to take a good hour. You're talking an hour and a half to move those people from point A to point B. So that's definitely a challenge that we're continuing to tackle. I think all those challenges also become the barriers as well, your typical funding barriers, keeping up with the development, getting a seat at the table when a city or a developer is coming in to kind of claim some land and bring in business. Bringing transit to the table, I think, is an important barrier that needs broken. Where I came from, one city was perfect at bringing us to the table, and another city would sometimes think of us as the afterthought. And I'm sorry, I can't bring a 35-foot bus down your road when you're the afterthought. I need several months of planning. While you were planning the development, I should have been planning the service. So those are some big barriers. Jan touched on the county barrier. Honestly, that is something for my first time in my 17 years of transit that I've actually gotten to help at least attempt. We are still confined by your traditional county funding models. Transit has become kind of entrapped in that. We have a local sales tax that services SARTA. So when SARTA is spending, how many hours a week out in Wayne County helping out with the Wayne County Transit, what are we doing to make sure that a Stark County resident's not paying for that, and vice versa? At some point, what is a Wayne County resident getting out of it that we can bring to them? So I think you're going to start seeing some of that. Those traditional barriers come down. It's just a matter of kind of making sure that the funding tracks back, as long as the funding model stays the way it is. And unfortunately, as the state funding becomes more stable as far as dedication to transit, you might start seeing some of that dependency lessen on the severely local area and allow us to regionalize a little bit. And I think that's a big opportunity that transit has right now, is being able to create partnerships where you can see those funding models kind of flow across the county line. Jan's got funding to help me bring buses out to Wayne County. We hold grants that allow us to take buses out to Wayne County. We operate Wayne County Transit within that traditional county line model, but we're starting to bring that down. We just entered into an agreement with Altman Orville. They had a need to get discharged patients out of the Altman. I believe it's their kind of their short-term care center, back into Stark County. Residents who had been discharged from Altman, Maine, sent out to Altman, Orville, we can get them back home in Stark County using Wayne County Transit. I think those new service models, I kind of touched on that as the challenge. I think those new service models are going to turn into opportunities as well, bringing more microtransit on-demand style services to these areas, to our areas, will help the larger agencies better help a smaller rural county provide service. The 3-day booking, Denise talked about 3-day booking. We've got that challenge here with Wayne County. We've got the challenge here in Stark County. Kind of moving away from that, having to plan ahead so much, and maybe trying to create a service model that would allow someone to get to the doctor tomorrow when they were just, kind of called in today. For same thing with work. Maybe maybe you're a person who's getting called in, but you didn't have time to get that ride booked. So how can we get you on the bus and get you there? So I think there's going to be some big opportunities that are going to start showing some becoming a reality, taking that opportunity and turning it into a reality. I think is coming soon. Advocacy, Transit's always advocating for their passengers. We have an entire outreach team from the people who do the marketing, the people who do the travel training, always working to inform, educate, push out the message of what we're trying to do with public transportation. Like I said, we've got 2 travel trainers. They go to any event, any resource fair that anybody has going on, please give us a call. And they like to educate also from the top down as well. So you might have, a group of social workers who don't know how to get their clients to and from their appointments. Well, send your social workers to learn from us. That way they can better educate their clients by becoming educated themselves about public transit. One of the pieces of feedback that we got through the customer service survey was we should be doing more outreach, and we all kind of scratched our heads wondering, well, what else could we be doing? But there's definitely more that, like Bambi said, there's definitely more that we should be doing. But we also need some help on knowing where to go with that. We have our when I oversaw travel training, we had our list of yearly events. But maybe there's a new event that didn't pop up that was, a first annual. So let us know, reach out to us, tell us what's going on so we can come out and tell people what we're doing here. I think Denise touched on some state lobbying, Ohio Public Transit Authority Association, we're all members of. We spend, all year in various committees and working with 2 lobbyists who truly believe are very passionate about transit, who go to the State House and really fight for that. And one thing that we've done the last several years is rather than sending executives to lobby on our behalf, we've been trying to get more and more testimonials from our riders, letting the passenger tell the story of why public transit is needed. I just came from a rural conference about 3 weeks ago. One of the transit directors down in Zanesville, he said that he met with one of those reps and got him to realize and help send that vote to the State House that it's very much real here in Southern Ohio. It may not look like the big city buses, driving around, but there's something out there that's moving people from point A to point B, and that's the message we're trying to do through the state lobbying. You're going to, I think, start seeing some of the larger transits pushed to maybe not provide direct assistance to the smaller transits, but there's kind of an idea out there that regionalization should probably be the better way to do it rather than by county, kind of what Jan and I do with Wayne County Transit. There's literally a highway that leads out of Wayne County and into Stark County and back again. So what are we doing along that line that's really helping keep people move? And I think there's plenty more that we could be doing. Wayne County Transit kind of exploded on us, and we weren't ready for that, I don't think. So now it's time to, now that we kind of know what we're doing with it, it's time to start thinking how to keep it from falling into those traditional service models, and kind of making sure that we are moving it forward, and move it forward as quickly as what the larger transit agencies are doing with their own services. I try to speak as quick as I could, so I'll gladly take any questions that I have, but I think I'm done with my thoughts, and don't want to hold everybody up.
Thank you. That's great information. And you do have a question. So does public transportation service senior housing communities, like independent or assisted living complexes, senior apartments, skilled nursing facilities, et cetera?
Yeah, you'll find that probably the basis of a lot of our service, hits major living centers, such as, where do seniors live, low income. I'm still learning the service side of SARTA, to be perfectly honest. I started here about 1.5 years ago. So kind of learning this area has been my biggest barrier, my personal biggest barrier. But yeah, so you'll find that it's the same, especially with the, Northeast Ohio kind of has a nice cluster of transits to kind of work off of each other. But yeah, large multifamily, whether it's low income, whether it's senior, whether it's, just your traditional apartment complexes are always passenger generators, or ride generators for us. Yeah.
Great. There's still some coming in. Do any of the transportation partners support discounted rides for veterans? Any specific support for veteran or family communities?
We may be having some information on that coming up soon, so stay tuned, but we internally have been working on that for quite a while.
So here at Ardo, we don't actually have something specific for veterans, but we have a subsidized fare program where we make grants to social service agencies that can buy fare at reduced rates. And we do make grants to our local veterans homes or agencies that assist veterans. So that's kind of how it runs here.
In Wayne County, our service is free to veterans. They don't have to qualify income wise. If they're a veteran, they can come in and fill out an application and be part of the program, and we take them, door to door where they need to go. Probably the biggest challenge with veterans is out of county, but we work hard to get them there and try really hard to make sure that happens.
Stark County, we don't have necessarily a direct fare, but we do provide 3 daily runs up to Cleveland. And while that route's open to anybody, it is geared towards the veterans, running between downtown Canton and the VA.
Good information. Thank you all. I think that is all the questions I have in the chat. So if any others come through, I'll be sure to let you know. I can go ahead and start sharing my screen here. But thank you all again for jumping on as our panelists today. It's certainly helpful. I know there's a lot of great information shared, and we'll be sure to get that to everyone through the recording. And thank you for sharing your time and expertise. And contact information is here if anyone needs to jot it down, but it will be in the minutes as well. And with that, I'll turn it over to Matt. Save the dates are up here for the rest of 2023.
Thank you, Courtney. And thank you again to all of the speakers today. I would like to offer an invitation for you to join us on Areawide. We could use your expertise and your thoughts as we all work together to make a better community for older adults, people with disabilities. And your work is, like I said at the top of the meeting, transportation is the #1 thing that we hear about on our Aging and Disability Resource Center. So thank you so much for joining us. With that said, I will say 17 minutes over, but it was I think well worth it. This was all really good information. I loved hearing about all the cool new things that are going on, especially the Portage County kind of app and the technology side of thing is very cool. I think that that's kind of what I was talking about when I said I don't think transportation will look the same when I need it as what people are getting today. So with that said, I will say I don't see any questions or comments in the chat other than some positive stuff. So I will wish you all a very happy Friday afternoon and have a great weekend. Thank you so much.